Hi, everyone. This is Phil Mattia. I'm the Director of Marketing and Communications for the Feliciano School of Business, and you are listening to the Business Edge podcast. Today's topic is we are discussing consumer behavior during the coronavirus pandemic. We are here with Dr. Patrali Chatterjee. She is the chair of the Department of Marketing at the Feliciano School of Business. She's also a professor of marketing and the graduate program coordinator for the digital marketing program. So welcome, Dr. Chatterjee.
Thank you, Phil.
So today, before we begin, I want to tell our listeners that we're recording this on April the 16th around noon. As you know, things are changing by the day. So if you're listening to this today, or if you're listening to it next week, just to give you a sense of where we are in the world. A couple things also on April 16th, which is today. Just to put things in perspective, New York, New Jersey, which our university is located in New Jersey, but we're obviously metro with New York City. New York has a requirement now to have face masks in public. Governor Cuomo just implemented that about a day or so ago. Our governor in New Jersey is requiring face masks in grocery stores. Also, the states, governors around the country are talking about reopening the economy, and this will all impact our talk here with Dr. Chatterjee, talking about how to reopen the economy, which obviously stores and non-essentials are a part of that. The curve with respect to the COVID virus, the COVID-19 virus, the curve is flattening. So what we're seeing across our country is that the number of cases are starting to flatten. Hospitalizations, ICUs are starting to go down slightly. So we're kind of at that point where people are thinking of what the new normal is going to be, and the new normal with consumer behavior, what that's going to look like in the next short term. Obviously, the states are at different levels of how they're handling the COVID-19 virus. But for the most part, we are kind of on the precipice of kind of getting back to normal, or the new normal, whatever the new normal is going to be. We're going to find out shortly. So we thought this talk with Dr. Chatterjee was definitely timely and relevant, considering that we are all consumers and we're all dealing with this new reality of when we're walking into Target or we're walking into a grocery store, or what we can expect of consumers, because consumer behavior clearly has changed. And so that's why let's kind of get into this topic. So let's first talk about how has this pandemic influenced consumer behavior?
Thank you, Phil, for the introduction. And you set up this context very well. COVID-19 is an adverse effect. It's an adverse event, and adverse events can be health-related, climate-related, security-related. But what they all have in common is how we as humans process them in our brains. These kinds of adverse events are characterized, are processed as being threatening our existence because we lack control over them, and we cannot predict a priori how they will hurt us, or whether they will even hurt us, or how they will hurt us, how they will affect our lives. So we as living organisms, just like animals, are vulnerable. And our purchasing behavior reflects our anxiety and our attempts to take control and bring certainty to our lives. These attempts to bring control and bring certainty to our lives take different forms in different parts of the crisis, or different stages of our crisis, and they affect people in different ways. For example, let me talk about the pro-dormant period, late February to early March, when we were leading lives as normal, but we were glued to our TV screens, mobile screens, computer screens, tracking the number of cases and deaths like we are doing today, and wondering whether we would need to be under a lockdown or stay-at-home order, as we saw them rolled out in certain states and localities in our country. During that period, early March period, panic buying had already started, even though it wasn't being talked about. panic buying in the form of stocking up or hoarding hand sanitizers, Clorox wipes, toilet paper, were all in effect an attempt to control, to avoid, or reduce or mitigate the threats to our lives. Some consumers overdid it, others did not. And the consumers that overdid it did it because they anticipated greater threats to their life. You will oftentimes hear about cross national or cross cultural differences in how consumers deal or whether they engage in panic buying. And there are lots of studies that show that consumers in the Far East who went through a similar situation did not see the level of panic buying. And that could have happened because either A, they have prior experience with SARS and MERS, and B, because we as Americans have a lot of space in our homes, most of us do, and we have places, we have ways to stock products, and uh, because we have the space, because we're grappling at stores in terms of how do I bring in more certainty into my life, how do I deal with this anxiety, we tend to it showed up in our behavior as panic buying and holding of goods. So that's what it was during the pro-dormant period. After the shutdown started, the panic buying continued. But what people bought has changed. And I'll talk about it more when we talk about uh, specific types of goods or specific industries and sectors that seem to be doing better than others. We are currently, what you just discussed, at a period which is the chronic period. So we moved from the pro-dormant period. The acute period was when the stay-at-home order was implemented in New Jersey, which was around the second end of the second week of March, right up to the end of March. The panic buying continued, and most people were anxious. That is when you saw this knee-jerk reaction of many companies selling so-called non-essential goods, closing down not just their physical stores, but also laying off their employees in their e-commerce operations because they anticipated people wouldn't be buying and they needed to cut back on their labor expenses to weather the storm. We are now currently, so we went from, we've transitioned from the acute period to the chronic period. This is the stage when we know we are potentially going to open. We just don't know when that will be. Ever since the talking of the flattening of the curve has happened, people actually are going out a little more than they used to. And anecdotal evidence from grocery stores seem to indicate that some consumers are actually visiting the grocery store more than once during the week, whereas in the acute stage, consumers were very limited in terms of their exposure to the store. And I've heard there is a lot of chatter on social media that indicates that people feeling a little more comfortable about going out may in fact lead to increase in number of cases. So behaviors are going to change. And right now, what we see is this nesting period where people are trying to make things better. They're anxious, but they've accepted it. They're trying to take this time to make things better, make their homes look better, make their families feel better. And that's again leading to different kinds of purchase patterns.
It's interesting about the panic buying because that's one thing that always amazed me early on when I was going to Costco and the supermarkets and people were buying toilet paper and water and paper towels and stocking up on it. And it always, and I understand it. It's well how you explained it, that we as Americans, we never experienced SARS and MERS and we have space to store things. And there was a psychiatrist I saw on CNN a few weeks ago and said another reason is we live in this world of uncertainty. And panic buying is if I can buy that toilet paper, that's in my control. I can buy the toilet paper and the paper towels and the water. That's something that's in my control. I'm going to buy more of it because it's that fear of being out, not being in control of anything. So the one thing I want to point out before we proceed is there's you're on Facebook and Twitter and your handle is DM at MSU. So it's David Mary, ATMSU. For those listening, if you want to follow, and that Facebook and Twitter is news on how digital marketing, how companies are using digital technology to address the pandemic. So again, that's DM David Mary, ATMSU on Facebook and Twitter. So we invite our listeners to go there to follow along on news. Next question is what factors that are driving consumer behaviors during this pandemic? What are some of the factors?
Um, there are various factors that are all affecting us at the same time. They're interacting with each other, and sometimes they have countervailing or opposing effects on how we process this crisis. The first, let me talk about the crisis itself. This crisis, unlike the other crises we have experienced in the past and the ones that come to mind, uh, that is that is that is the closest, is what happened during Hurricane Sandy. Uh, the biggest difference between this crisis and the previous crisis is the unpredictability in magnitude and duration. We didn't know when this was going to hit us. Whereas with weather related events, climate related events, we typically are forewarned. We see the number of cases happening elsewhere. We see it slowly ticking up. Every crisis is local in nature. It only becomes a crisis if it's local. If it's a crisis happening elsewhere, we are interested in it. We get engaged with it, but it doesn't get processed in our brains as being threatening. This has started being processed as being threatening when it started getting local. So the biggest challenge with this crisis is its unpredictability. We don't know what the numbers will look tomorrow. We don't know when it's going to start, when it's going to end. It's non-binary. The start and the end is non-binary. We can't see the virus, so we don't know how to avoid it. We can't see its damage unless and until we get personal experience with it. There are no physical or observable signs for a start and an end. And that makes it more potent. Because it is global in magnitude, and we look at examples of things happening in other countries, and the extended period of time, happening over an extended period of time, this is more of a chronic crisis. And because it is a chronic crisis, it is leading to some extent to feeling of fatigue. This feeling of fatigue is leading to a lot of different kinds of internal and external factors that become salient. The remedy for this particular crisis is social distancing and stay at home. Because these remedies do not lend well for out of home experiences, we have no way of reducing our anxiety, or even in some ways addressing it through normal things that we had done before. For example, going out for a walk, or engaging in activities, going to our local library, going therapy shopping, or even going to a gym. So because these stay-at-home remedies do not lend well to reducing the uncertainty, they are increasing our anxiety and vulnerability rather than reducing it. At the same time, the availability of digital and remote communication technology and their accessibility to a wide swath of population are making it possible for consumers to experience what is called ambient presence. And that increases the feelings of normalcy. What I mean by ambient presence has to do with our using digital technology to not just see our family and friends and interact with them, but also experience our coworkers, our celebrities, be more personal than we have seen before. And what you will see, or what you will notice, is those, and I'm when I talk about celebrities, and they, I think, are playing an important role during this period, especially with younger consumers. The fact that they are recording, they are doing their talk shows from home, wearing their sweatpants, and talking about how their kids and pets and friends are helping them conduct their shows, leads to increased feelings of personal closeness or ambient closeness to these personalities. And so they are increasing feelings of well-being, normalcy, and closeness to a shared experience, a shared crisis. Many of us are doing things and spending a lot of time doing things we usually do in our times. Pre-COVID, we are attending school, teaching, conducting meetings. Some of us are even doing our medical visits online, and that makes that again affects how we are processing this pandemic. I think we will always, at least for the next 10 years, I think, talk about our lives pre-COVID-19 and post-COVID-19, and a lot of what we are doing now is uncovering a lot of uh, practices that need to change. This has been a disruptive event, and most people will associate disruptive in terms of negatives, but I can clearly see how many of these events or many of our practices now become a part of our regular life and make our lives better, make us more efficient, make us more productive as we go through our lives in the post-COVID-19 era.
Yeah, a couple things you mentioned early on was the unpredictability and of the duration of this virus. And the one thing I've said to friends is it's like the snowstorm example where you know it's going to snow, and typically everyone runs out and gets the milk and bread and do the panic buying. But you know that that snowstorm is going to take a day, maybe 2 days. The roads are cleared, everyone goes back to work, and you can go back out. You're absolutely right. The concern here is we don't know how long this is going to last. We looked at China and South Korea to get a sense of, because they've gotten past it for the most part. But it's more the new reality. And your comment is right about the post-COVID. What we don't know, and I don't think some people are expecting that the light switch will go on, we all go back to normal, we go back into the stores, we shop like we normally shop, and we do everything like we did pre-COVID. But that's not what it's going to be. And California just came out with some guidelines yesterday of what the post-COVID world is going to look like, and things like restaurants, you eat at a separate every other table, and
Yes.
even talking about having, before you go into a restaurant, you have your temperature checked at the door to see what your temperature is like before you can go in, and even to the extent of providing a saliva sample to see
Yes.
if
Yeah.
you're COVID positive. So these are all things that's going to be our new world until there's a vaccine, and we hope that happens next year, and we hope it works, and I think we're pretty confident there will be one, and just depending on timing. But I think we, as consumers, especially, and speaking, I'm an American, so we're just used to everything being easy. You go to a store, you buy something, you go to your self checkout lane, and you leave. We're not used to challenges like this where I have to wait online for something, or I have to stand 6 feet away from someone before I walk into Target, or if I walk into to the mall. It's going to be really challenging for consumers. I know, especially here in the U.S., that we're not accustomed to this. And so, and you also mentioned young people, and that leads me to my next question about generational purchasing responses. So are retailers experiencing generational purchasing responses during the pandemic? Are people acting differently based on their age?
Absolutely, and they are experiencing differences in purchasing patterns during the pandemic. Many of them are, most of them are responding to it. The first thing many retailers did, I believe, in early April, is they responded by setting aside specific hours for senior citizens. Some have done it early in the morning, others have done it in the afternoons. And some retailers have also extended it to other parts of the population that are more vulnerable to infection. And they've set up separate cashier counters for pregnant and immunocompromised customers. There are some retailers that have actually changed their planograms in terms of where certain products are going to be stocked, making some products available right at the entry of the store or close to the back entry of the store. And they're restricting, the specific areas only to people who meet certain types of conditions. Parents that have to come with babies to the newborn babies or young babies to the store, senior citizens, pregnant women, or even men with little kids. Retailers are definitely responding to it. Retailers have also changed their merchandise assortments to address the needs of different populations. There are many stores that now carry puzzles in their stores, many stores that did not carry different kinds of indoor games. They now have restocked or changed their assortment to bring these kinds of products in their stores so that consumers, it's an example of scrambled merchandising. And we don't know whether whether they will maintain this going forward or whether they even need to. And they have changed their assortment. A lot of pet products in the store that consumers typically go to the other stores because they realize most consumers, when they go on a shopping visit, want to go uh, and make their purchase. They want a one-stop shop. And so that's the reason you see the Walmarts of the world and the Targets of the world doing very well, because they organically they are set up to sell a wide basket of goods to consumers. Retailers are also responding to the so-called negative aspects of or normal shopping behaviors that could have negative aspects to consumers. For example, many retailers now have announcements telling customers not to have family shopping in the store. Some retailers are in fact restricting the number of people in a family to one or two, and the second person may be a baby. It cannot be three people with a baby. So the retailers are responding, and I'm sure they're making exceptions to the rule. So in terms of generational purchasing, they are trying their best to address the needs of different types of customers based on their target population. One thing that American retailers have better than many retailers in other countries and even smaller retailers is an extensive record and extensive data on purchase behaviors, which provides very important clues to what the generational makeup of their store population is.
One of the things that I thought a lot about is retail, and obviously retail was taking they've been challenged obviously with the online model and Amazon, and they're struggling the in-store as opposed to people just shopping online. And they over the last several years, and I know you've done a lot of research on that. But the one thing that comes to mind is now that we're shopping, and we don't know this because you don't have the data yet, but we're probably shopping more online during the pandemic. And once we get to a place where you can go to a store, whether it's a mask or social distancing, where things start opening up, as a consumer, if you were shopping online prior to COVID, during COVID, you're still shopping online, maybe shopping online more. But there are probably more consumers out there who would typically like to shop in the store and say, well, I'd rather go to the store to try it out, to feel the dress before I buy it, or to play with the toy before we purchase it. But now they're shopping online because of COVID. But once we get to that place where we're pre-vaccine, but still during COVID, and we're able to go to the store. What are your thoughts? And data will prove this out over time, but what are your thoughts on, will consumers be quick to return to in-store, and as opposed to say, well, you know what, I typically go to Target once a week, but now with this COVID, I'll just keep shopping online. I'm not comfortable yet. What are your thoughts, or what are your predictions on what's going to happen with the in-store shopping experience?
So in terms of in-store shopping experience, I strongly believe online purchasing will continue, but it is going to have different kinds of implications based on the types of products and services retailers provide. If, for example, an important characteristic or important benefit for the success of online retailing has been the ability to return products to the store. And that is under threat at this time. Most online retailers selling personal goods, for example, food items or clothing, have clearly stipulated policies that prevent consumers from returning items. So their reverse supply chains are pretty much locked down right now. And that is in part to control the spread of the virus. Uh, it is the same situation with grocery retail too, where most retailers now refuse to take any returns. In the case of grocery or in case of home goods, that is less of an issue compared to products that are more self-expressive, products that basically communicate to people who I am based on my consumption. They are all public products that are publicly consumed. So once we get to a stage where the lockdowns and shutdowns and stay-at-home orders are lifted, um, but pre-vaccine, consumers will not necessarily rush to the store unless and until we have some sort of contact tracing technology that has wide adoption, A. And secondly, the availability of PPP in store is robust. Many retailers right now, including store-based retailers, don't have disinfectant wipes. Most of them do, however, have their employees wearing masks. So consumers will go back to the store, but it is going to take some time. In some product categories online, sales have gone through the roof, and they will keep going through the roof post COVID-19, because consumers have suddenly discovered that they are not very bad in their identifying things that they will like, and they will keep doing it. For example, right now we are in what is called a nesting period, and most of us are channeling our excess time and energy and dollars towards making our home more welcoming and pampering ourselves and our family members. So what's running out these days is East hair color, decorative mirrors, home decor. Home decor prior to COVID was not a popular category online because consumers always had to deal with the situation. Consumers thought, I need to see something to really know whether it's something that will work for my home. But what has picked up online, what has picked up through the COVID-19 is Bed Bath & Beyond having one of their best quarters in the last 2 months. Wayfair with sales over the roof. Pier 1 Imports that went into bankruptcy a few years ago, now having a robust online business. So it is going to be, the winners and losers in each of these categories will change because consumers are discovering changes in their behaviors themselves. They're getting more confidence and certainty in making certain kinds of purchases online versus in store. And that's going to change how we shop. In terms of in-store purchasing, most retailers had rejigged their retail strategy to make the store experience more experiential. And I'm talking about the American Dream Mall, which had, that has a lot of impact for us as a state and for us as a school, had planned on 50% or 60%, 45% retail and 55% experiential. They're really worried about whether consumers are going to come back to the store. Stores like Nordstrom, etc., were going to Saks Fifth Avenue, were going to have their futuristic stores open up sometime in August of this year. And are consumers going to be comfortable to go to one of these stores, luxury stores, and try out clothes, touch and feel, even if it's digital on a screen? That remains to be said. And it is going to take some time. It's going to have a negative impact on in-store shopping, but I'm sure retailers will rethink what experience in a store means in this post-COVID era. And the ones that do it well will succeed.
Yeah, it's interesting about technology. For example, my personal situation, my wife and our young son, when I go grocery shopping, I go to the grocery store pre-COVID. And now everyone is doing the Instacarts and the Whole Food delivery.
Exactly.
And something that we've never done before. We shop at Whole Foods typically, and now we do Amazon. I'm giving a plug to Amazon here, but Amazon, I forget what it's called, but you go to the app and it's delivered within 2 hours. The challenge is you have to get your time slot, and you're not getting a 2-hour delivery. Typically, it's a week, 7 days. And what's happening now, and I see this all over Facebook, that people get a time slot and post on Facebook and say, ShopRite has time slots next Thursday, and people rush and try to get a time slot to get delivery. So what I wonder what's going to happen when things start opening up and people start going back to work and living in whatever new normal is going to be, how do those stores handle that? Because right now they have delivery drivers for Instacart or for Whole Foods or ShopRite, whomever, but they're going to have to figure out, should they staff up? And if there's typically 90% of people shop in the grocery store, but then with COVID, it's now 30%. But once we get back to some of our new normal, what that percentage will be? Will people then say, like myself, I said to my wife the other day, I said, even when we can go back out, I'm still going to shop online with Whole Foods. I'm not going to go in the store because I want to minimize the risk. And I think that'll be a challenge for the stores to figure that out, of what the consumer behavior is going to be like on shopping online for groceries, or even Target, for example. I mean, we have a young child, so we shopped on Target a few days ago to buy paints and stuff for arts and crafts stuff for him to do. And I want to send some of it back. And I simply just boxed it up. And instead of me going to the UPS store to drop it off, or I scheduled delivery and the UPS guy came, picked it up, and it was returned. So I think, to your point, this new world we're living in now, people are being forced into these new technologies, this new behavior. The question is, will that behavior continue pre-vaccine? And one thing I remind people, because people think the vaccine's the end-all, cure-all, which it will be, but the amount of time it would take to vaccinate, even in this country, 340 million people, would take months. And then you think of the world, and then you think of, again, I'm not a scientist or a doctor, but it would take years to vaccinate everyone. I don't know what the number is, but people forget that. They have to understand that.
Yeah, I totally agree with you. And again, even by all accounts, it appears that it's going to take minimum of 6 to 8 months to be made available, or to be deemed to get authorized to be used. And it is going to take a lot of time. It's going to be a rolling vaccination schedule, and it will take months for it to happen. In terms of how retail will be impacted, goods and services that are, and I talk about services because that particular sector of the economy is practically closed down, but they are an important part of retail too. um, there will be a difference in how the must-have services and must-have products, stores that sell must-have products or essentials operate versus the ones that sell nice to have products. So absolutely, most consumers are resorting to online purchasing when they can. For example, I buy a lot of ethnic products, and for me, ethnic product shopping is more of an experience. I want to go and discover. I want to talk to the people there, whether they be in the Greek store, Indian store, Ethiopian store. And most of those retailers have ran out of their stock. They have their online stores, and the stores are open once a week because their scales of operations were so small. And I spoke to one such ethnic retailer as part of my entrepreneur, as part of my research yesterday. And he says that, to do what right now is a missed opportunity for me, but in order to scale up, is this behavior going to continue? Are people going to buy these products to that extreme? And that is a big question that everybody's asking. It's not just how we shop that's changed, it's also what we shop for that has changed. And most retailers practice what is called just-in-time inventory management. They typically have 2-3 days worth of stock. In the grocery retail, in apparel retail, it's probably 2 weeks. Okay, and right now they are, in some cases, they're facing situations where their stock is completely once they stock their shelves, their stock is completely finished in 2 or 3 hours of after they're stocked. And in other parts of their store, for example, I talked about scramble merchandising, stores that sell products like, let's say, home appliances, etc. Nobody is buying them. People, most stores bring in air conditioners or fans in the store at this time. Nobody is buying them. Okay, and so behavior has changed. Whether consumers will go back will depend on what they buy along with it. And that is what retailers are trying to find out. And it is an opportunity for a lot of research in that area. Most retail chains are studying what's happening, and they're also tracking what happened at the beginning versus what's happening now. And because they have this 2-week advance ordering period, they are actually in a better time. And I believe retailers will perform very well, especially those that are taking advance orders, because they have a lot more visibility into their sales pattern going forward than they ever had before. Other industries, other retailers that are doing very well online are retailers that sell video games and different kinds of streaming service subscriptions. Many of them, consumer technology, they are doing very well because they're using this period now to introduce what are called trial versions of products and services that are going to roll out in the future. And this is a wonderful time for them to get consumer feedback, beta versions of different kinds of games, get consumer feedback that will play out well going forward.
Yeah, I mean it's such an interesting time, and I know we'll do another podcast in the next couple of weeks, because I would love to hear your thoughts on when things start opening up and what you can share, because your knowledge and expertise is valuable to retailers as well as consumers, because it's the big mystery now. We all have these thoughts of what it's going to be like when states start opening up and people start shopping, and these are all mysteries, and it's changing by the day. So, but before we wrap up, I just want to remind everyone again, the Facebook, Twitter, it's DMATMSU, David Mary, so DMATMSU. Take a look at that on Facebook and Twitter for updated information about digital technology. Dr. Chatterjee, thank you. This was a great discussion. We'll do this again in a couple of weeks, just as you are getting more knowledge and information on what's going on in the consumer behavior world, and we'll continue on because this is for months. So thank you again.
Thank you. Phil, just 1 second.